29-year-old woman comes to the physician because of a 5-week history of fatigue and a 4-day history of heart palpitations and anxiety. She has primary hypothyroidism treated with triiodothyronine. She says that she has doubled the dose of the medication over the past week because of fatigue. Thyroid function testing is most likely to show which of the following sets of serum concentrations. So this patient has a history of hypothyroidism and she's taking T3 as her thyroid hormone, and she has recently doubled the dose of her medication, and now she's presenting with symptoms of hyperthyroidism. And we have to find the lab values that she would most likely present with. Let's draw out the pituitary axis so it makes more sense. So here we have the anterior pituitary, and the anterior pituitary is going to release TSH to stimulate the thyroid gland to produce the thyroid hormones. So let's say that this is the thyroid gland. Let's write TG for thyroid gland. And so this TSH is going to stimulate the thyroid gland so that it produces thyroid hormones. So now, once the thyroid gland is stimulated with TSH, it's going to produce T3 and T4. The hormone that it is going to mostly produce is going to be T4. Majority of the T3 that we're going to get is going to be from the peripheral conversion of T4 to T3. So we're also going to get peripheral conversion of T4 to T3. Now, this patient is taking T3 as her thyroid medication, and she has doubled the dose of the medication, and she's presenting with symptoms of hyperthyroidism. So this means that her T3 must have been elevated. So when we take a look at these answer choices, we can cross out these answer choices because she is presenting with symptoms of hyperthyroidism and she's taking T3 as her thyroid medication. Now, because thyroid hormones have the ability to send a negative feedback to the hypothalamus and the anterior pituitary, now we're sending this negative feedback because of this elevation in T3. So now the anterior pituitary is going to produce less TSH. TSH normally goes on to stimulate the thyroid gland for it to produce thyroid hormones. Now, because the thyroid gland is being understimulated, it is going to end up producing less thyroid hormones. So we would have less T4. Remember that the hormone that the thyroid gland is going to mostly produce is going to be T4. So it's not going to produce as much T3. And because the patient is taking T3 from her medication, the T3 level is going to be elevated. So these are going to be the serum findings that we're going to see. So we will see a decrease in T4, decrease in TSH, and an increase in T3. So the answer choice is going to be F.